In today's topic, I'll be sharing with you ways that you can prevent miscarriage in pregnancy. So if this sounds like something that interests you, kindly watch this video to the end. Welcome to my YouTube channel. Pharmacist Ngozi Okafor is my name. Very happy to be here again once more, and I want to use this medium to appreciate my wonderful subscribers. You guys are the best. I love you guys. I am very grateful. I appreciate you guys. Thank you very much. Today I'll be sharing with you ways that you can prevent miscarriages from occurring when you are pregnant. According to the National Infertility Association, as many as 80% of pregnancies may end in miscarriages, with more than 50% losses going undetected and mistaken for a period. So guys, there are many reasons why miscarriages occur, but it results within these two factors. Number one is the environment where the embryo is growing. That is to say, the embryo's environment does not support its growth. Number two is the product of the pregnancy. That is the embryo itself. That embryo was damaged and could not develop into a healthy baby. Whichever one this is, it still revolves around chromosomal abnormalities, immune abnormalities, progesterone deficiencies. These are things that can lead to these miscarriages. Guys, the following conditions can lead to miscarriage in the first trimester. Number one is genetic problems, blood clots, ectopic pregnancy, or placenta issues. For the second trimester, the things that can lead to miscarriage is infection, chronic diseases like thyroid disease, fibroid, cervix problem, or lifestyle factors like smoking, alcohol, drug use, or caffeine intake, and also exposure to chemicals like phthalates and xenoestrogens. All this can lead to miscarriage in second trimester. While in third trimester, pregnancy complications, uncontrolled diabetes, insufficient blood supply to the placenta, infection, and umbilical problems can all lead to miscarriages in the third trimester. And when miscarriages occur in the third trimester, it is usually referred to as stillbirth. Threatened miscarriage is where the woman has bleeding and abdominal pain while the pregnancy is still viable. It's important to note that spotting is common in first trimester. But if the pregnancy progresses and a woman continues to bleed, it is known as threatened miscarriage. So anybody that is going through this is supposed to go to the hospital for proper examinations. Other kinds of pregnancies that result in miscarriage is ectopic pregnancy, where the implantation of the fetus is outside the uterus, which 90% of the time occurs in the fallopian tube. Most often than not, blocked fallopian tube can lead to this kind of problem, ectopic pregnancy. When this occurs, the likelihood of having miscarriage is actually high. Another one is molar pregnancy. In molar pregnancy, a non-viable egg implants itself in the uterus. A non-viable egg means an egg that is not likely to survive implants itself in the uterus. Therefore, this leads to miscarriage because it won't develop or thrive. Another one, guys, is blighted ovum. In the case of blighted ovum, a fertilized egg implants on the uterine wall but does not get to develop into a healthy baby. So this eventually comes out as miscarriage. Guys, let's go straight to symptoms of miscarriage. How can a pregnant woman know that she's about to have a miscarriage? What are likely symptoms? And when you see, you hasten to the hospital for immediate attention. Number one on the list is spotting. Spotting or vaginal bleeding is one of the major symptoms of miscarriage. Other symptoms are back pain, abdominal cramping, weight loss, vaginal discharge, that's fluid discharge, vaginal discharge of clotted tissues, lightheadedness. So these are symptoms that when you experience them, you need to rush to the hospital for immediate medical attention. So guys, let's go straight to the ways that we can prevent miscarriage in pregnancy. Number one in our list is zinc supplementation. It's possible that you are zinc deficient. Zinc deficiency in women leads to inability to maintain pregnancy and give birth to a healthy baby. This is because zinc is the most important mineral and antioxidant in pregnancy and preconception. Zinc is required for fetal growth, development of the muscle and bones, immune function, and bone formation. And a research study has shown that 82% of pregnant women worldwide are deficient of zinc. So therefore, zinc is very necessary for fertility, pregnancy, and fetal development. It has been shown that zinc plays a very important role in women. Zinc zinc is very important in sexual development, ovulation, and menstrual cycle. Zinc is also very necessary for various processes like cells division and fertilization. Research has shown zinc requirement for oocyte, that is for female egg development, and even embryo development. Zinc deficiency in females can therefore lead to smaller eggs than necessary, disrupted egg cell growth, problems in cellular development, and impaired ability of the cells to divide properly, which is a very important factor in fertilization. When a woman is deficient in zinc during pregnancy, it can lead to miscarriage, retarded development due to chromosomes abnormalities, that is the DNA. Also, let us not forget that zinc is also very important in male fertility, and if a man is deficient in zinc, it also affects his sperm quality. Zinc is very necessary in males, especially for capacitation and chromosome reaction in fertilization. In males also, we should not forget that zinc is necessary for testicular development and sperm maturation. Therefore, zinc deficiency in men has been linked to low testosterone level, low sperm count, and low sperm motility. Some symptoms of zinc deficiency. Number one is frequent colds and infection. You know, zinc is an antioxidant. So if you have a lot of zinc in the body, it helps to prevent cold and infection. Number two is lack of appetite. Number three is white spots on the fingernails. Four is mental exhaustion, dry skin, and hair loss, and also poor sense of taste and smell. These symptoms, of course, are not exclusively for zinc deficiency, but these are symptoms that shows that one is deficient in zinc. It's also important I mention some sources of zinc, natural ways that we can get zinc apart from supplementation. One is lean meat, egg yolk, oysters, and whole grains. These are natural sources of zinc. Also, you can supplement with zinc. It's very important that when you are taking zinc, you take it last thing at night. It's not supposed to be taken with food. And zinc needs an acidic environment for proper absorption, so you don't take it with food. And if you're taking proton pump inhibitors or antacids, you don't take them with zinc. You give time before you take zinc. Zinc is supposed to be taken on empty stomach so that it can be properly absorbed. And when you are supplementing, make sure the zinc that you're buying is either zinc acetate or zinc picolate. Do not buy zinc oxalate because that is the least absorbed in the body. The second thing that can help to prevent miscarriage in pregnancy is to boost progesterone level. For pregnancy to be maintained, progesterone has to be at the optimal level in the body. Progesterone is so known as pregnancy hormone, and deficiency of it can lead to miscarriages. Progesterone is very important for maintaining menstrual cycles and is very necessary in maintaining pregnancy in early stages of pregnancies. Progesterone stimulates the blood vessels in the uterine lining to produce nutrients for the nourishment of the embryo when the egg is fertilized. It is also responsible for preparing uterine lining for implantation and for maintaining the pregnancy throughout the pregnant period. So what this means, guys, is that even if ovulation occurs, normally if ovulation occurs, the progesterone starts preparing the endometrium for fertilization and implantation. In a situation where the body is lacking enough progesterone, even if ovulation occurs, there is no enough progesterone for preparing the endometrium for implantation. Even if eventually implantation happens, miscarriages can still occur because there is not enough progesterone to sustain the pregnancy. What can cause low progesterone in a woman? So guys, causes of low progesterone in the body. Number one is abnormal thyroid function. Number two is stress. Number three is high estrogen level. Number four is poor ovarian function, and number five is increasing age. All these can lead to low progesterone levels in the body. Now let's look at symptoms of low progesterone. How can you know that you are low in progesterone? Because if you can able to identify it early, you can be able to fix it even before conception takes place. So how do you know that you are deficient in progesterone? Number one symptoms of low progesterone in a woman is spotting before periods. So if you're experiencing spotting before periods, it could be a sign that you are low in progesterone. Number two is breast tenderness. Number three is sugar cravings. Number four is irregular periods and short cycles. Number five is ovarian cysts. Water retention is number six. Low body temperature and miscarriage. These are symptoms of low progesterone in the body. So let's look at ways that you can increase progesterone in the body. One is by making sure that you are eating balanced diets that have all the micronutrients that your body needs. Also guys, to improve progesterone levels, you need to improve your consumption of vitamin B complex, especially vitamin B6. Also ensure you are getting enough magnesium. Another in the list is taking a lot of organic dark green vegetables, blackstrap, molasses, nuts and beans. These are foods that will help you to get the micronutrients that you need for your body to make enough progesterone. It is very important guys that you avoid dairy products, because research has shown that most of these dairy products contain high amounts of hormones, because these animals were fed with hormones, and this hormone disrupts your own hormone because they increase your estrogen level, and when there is high estrogen level in the body, it leads to low progesterone. So guys, we are still on the topic how to prevent miscarriages in pregnancy. Number 3 is supplementation with vitamin C or taking adequate vitamin C. The strength of the uterine lining of the uterus is essential when we are talking about pregnancy and how to prevent miscarriages. It is important to note that if the connective tissues of the uterine lining is weak, the embryo will not be able to attach or stay attached to the uterine wall. The quality of the connective tissue and the blood vessels is dependent on the amount of vitamin C in the body. So it's important that you take adequate vitamin C to strengthen the connective tissue and the blood vessels of the body. Also, taking enough bioflavonoids is also very important, because bioflavonoids help the body to absorb vitamin C. So if you are lacking bioflavonoids, the body may not be able to absorb adequate amounts of vitamin C. It's good to have enough bioflavonoids in your system, and bioflavonoids can easily be gotten from colorful fruits and vegetables. So if you include colorful fruits and vegetables in your diet, of course you'll be able to get enough bioflavonoids, which means the vitamin C that you're taking will be absorbed and properly utilized in the body. So the resultant effect of this is strengthened connective tissues and blood vessels. Sources of vitamin C. Vitamin C with bioflavonoids are easily sourced in the pharmacies, but apart from that, if you want to get your own vitamin C naturally, citrus fruits is your best option, preferably lemon, lime and grapefruits. Also, apart from colorful fruits, vegetables, berries are also packed with bioflavonoids, even tomatoes. So guys, we are still on the topic how to prevent miscarriages in pregnancy. Number 4 is quality of the sperm. Research has shown that miscarriages occur more when there is low sperm quality. This low sperm quality has a lot of causes, and one of them is smoking. Research has shown that miscarriages more commonly occur when there is low sperm count or visibly abnormal sperm quality. This normally occurs more when a man is addicted to smoking. Research has shown that when men quit smoking for 5 to 15 months, sperm count and viability is improved 50 to 800%, and this helps to prevent miscarriages in pregnancy. Number 5 on our list, guys, is avoiding alcohol-related drinks or coffee. Research has shown that alcohol is harmful to both egg and the sperm. So as little as 1 cup of coffee can reduce fertility by 50%. This we are taking during early stages of development of the embryo. It can lead to damage to the developing embryo and can also result in miscarriages. This is because research has shown that drinking coffee before or during pregnancy doubles the risk of miscarriage. So number 6 on the list, guys, is preconception care. Preconception care are the things that you do before trying for pregnancy, how you took care of yourself, how you take care of your body before trying to conceive, because this also contributes to how healthy the developing embryo will be. And there are preconception cares that we can indulge in that will help to prevent miscarriages later in pregnancy. Number 1 is eating anti-inflammatory foods. Anti-inflammatory foods are vegetables, fruits, legumes, oily fish, nuts and seeds, even increasing amount of herbs like turmeric, and using very good oil like olive oil in our diet. These are anti-inflammatory foods that will help to prevent inflammation in our body. Another is increasing antioxidant foods. Antioxidant foods are foods that are brightly colored, all those brightly colored fruits and vegetables like dark living green vegetables, tomatoes, apples and all that have high amount of antioxidants, and these antioxidants are also anti-inflammatory, and they help to take care of our body by eliminating free radicals from our system. Taking good fats like oily fish, avocados, nuts and olive oils are also part of the preconception care that will lead to long-term healthy pregnancy. So guys, number 7 on the list is taking herbs like Vites. The English name is chest tree, also called Agnus cactus. What this herb does is so it helps to boost the progesterone in the body. Another herb that if you find it around you and used to prevent miscarriage is called cranberry. Cranberry is Viburnum opulus. Its work is to reduce uterine spasm, so helping to ensure healthy pregnancy. So guys, these are how to prevent miscarriages in pregnancy. These are the things that you can do to boost your chances of a healthy pregnancy and to prevent miscarriages during pregnancy. Thank you very much guys for watching. If you're benefiting from my videos, please kindly subscribe, like, and so that others can also get to see them and benefit from them. Thank you and bye.